The most important thing is that young people are different to other cancer patients, that they are stopped in their tracks when they're diagnosed with cancer at a time when it's not thought of as a young person's disease. So they're already an anomaly within the cancer system, within their friendship groups, within relationships, within work. And it impacts every area of a young person's life. It impacts every area of a person with cancer's life. But what's different is it's these key milestones. It's the time where you're building your blocks of life. And so what is important is to ask young people what matters to them. What's really important to them, to be able to continue to have control, to be able to understand what they want to continue to be able to do in their life, and how we can help people with cancer to be able to not just look at what they can do right now, but by giving them forearming. To forewarn someone is to forearm them. And I think it's so important to be proactive rather than reactive when it comes to cancer care. And, you know, some of the biggest things that young people face are the worst cancer-related fatigue in any other age group is between 20s and 30s when it comes to the quality of life survey. It also, we know that young people tell us that they have worse anxiety and depression. We know that people are telling us that they've struggled to go back to work, they struggle to date, sex and relationships is left out of the conversation. Yes, it's embarrassing, but it's something that we need to help people to be able to continue to have healthy, happy relationships. To understand what life will be like post-treatment, I think is one of the things that we do a disservice to people with cancer. I think we need to prepare them, equip them, in advance before it happens, but also those I feel really, really strongly, and Trekstock feels really strongly, that we need for people to understand what is coming after they've been diagnosed with cancer. We need to understand that people may not hear what you think they hear when they're diagnosed with cancer. We need people to know that by getting active during treatment is going to be reducing other problems that they will face. People with cancer are more likely to have fractures, more likely to be unable to work, to be infertile. And then don't get me started on early menopause. You know, early menopause is something that 40% of people under 40 who are diagnosed with cancer will experience. And in terms of if people can't be given HRT, then we need to be able to give them the tools and understanding of the ways that we can help them to manage those symptoms, manage those long-term health outcomes, the fear that comes with getting diagnosed with cancer at such a young age.